Following on from my questioning of the Taoiseach Lever Adcar in the Dáil last Thursday on the issue of picking up COVID infection in our hospitals, we now have had the disclosure that in the case of at least one hospital, up to 5% of staff unknowingly were COVID positive. And we now have the admission that 40 people a day have picked up COVID in our hospitals this month. At the same time, we've had examples in our hospitals, like Portiuncula Hospital in Ballinasloe, where staff are getting their second vaccine shot, while some frontline nurses and care staff in the same hospitals have yet to receive their very first vaccine shot. And all this while the HSE distribution of the higher specification FFP2 face masks is being allocated centrally to hospitals, but only on the basis of the number of patients who are already COVID positive, rather than on the basis of the actual risk to patients and staff. But none of this should come as a surprise. Last November, I pointed out to An Taoiseach that operations were being cancelled in our hospitals due to the scale of COVID infections. And on the return of the Dáil earlier this month, I pointed out to the Minister for Health that some of our hospitals did not have enough bins to cater for the volumes of contaminated PPE that was being generated. And last week, I pointed out to the Taoiseach that after 9 months dealing with the COVID pandemic, the HSE still had not put in place a national outbreak management team to ensure that we had a consistent approach to controlling the spread of this deadly virus in our hospitals. This is the same organisation that only reluctantly established such a team 7 months earlier in our meat plants, but only after I persistently highlighting the issue. We now need to see a far more proactive approach to controlling COVID acquired infection in our hospitals. This is now urgently needed for patients, for frontline staff, and for those who sadly will need our hospitals over the weeks and the months to come.